Hi, good night guys, Dr. Assistant here. So tonight we're going to be doing the anterior triangles of the neck. So we're just going to start it with the main triangle, which is bounded by the anterior border of the sternocleidomastoid laterally right here, as well as the sagittal line drawn down the middle of the neck right here, as well as the inferior border of the mandible. So this is the superior border here, which is the mandible, sternocleidomastoid, which is lateral, as well as the sagittal line drawn down the center of the neck medially. Now the roof of the anterior triangle is bounded by the investing layer of fascia, and the floor is formed by a visceral layer. There are 8 muscles in the anterior triangle. I remember them via the acronym MDGS for the suprahyoid muscles and TOS for the infrahyoid muscles. These are both 2 acronyms that are used to memorize the muscles within the anterior triangle. The suprahyoid muscles of the anterior triangle, if using the acronym, they are the mylohyoid, digastric, geniohyoid, as well as the stylohyoid. The W in the MDGSW acronym does not stand for any muscles. Now the infrahyoid muscles, represented by TOS, will be the thyrohyoid, omohyoid, sternothyroid, sternohyoid. Also present in the anterior triangle is the common carotid. If you remember from before, in your anatomy, the common carotid bifurcates at the level of C4 or the upper level of the thyroid cartilage. Also present in the anterior triangle is the internal jugular vein. Cranial nerves 7, 9, 10, 11, and 12 are present in the anterior triangle. Also present in the anterior triangle would be the thyroid gland. So this is taking a quick look. You see the different triangles that the anterior triangle can be broken up into, which would be the submental, submandibular, carotid, and muscular triangles. So the first triangle we're going to look at is the carotid triangle, bounded anterior inferiorly by the superior belly of the omohyoid right here. It's bounded anterior superiorly by the stylohyoid, superiorly by the posterior belly of the digastric, as well as posteriorly by the anterior border of the sternocleidomastoid. Contents of the carotid triangle would be, as the name suggests, the carotid. Also present within the carotid triangle is the superior thyroid, ascending pharyngeal, lingual, facial, and occipital branches of the external carotid. External carotid and internal carotid lie side by side, forming the roof of the carotid triangle is the superficial fascia, platysma, and deep fascia. As you remember, the platysma originates from the supraclavicular and infraclavicular regions, and then it splays like a fan right up to insert into the muscles of the face. The floor of the carotid triangle, I memorize it via an acronym. The contents of the floor: thyrohyoid membrane, the hypoglossus, and the constrictores pharyngeus medius. Now, if you remember from your respiratory anatomy, this, as you see right here, is the look at the trachea right here. This is the thyroid cartilage, and this is the thyrohyoid membrane. The thyrohyoid membrane, if you see above, is attached to the body and greater cornea of the hyoid bone. Below, it's attached to the thyroid cartilage and the superior cornea right here. Now, the interesting thing about the thyrohyoid membrane or the thyrohyoid ligament is that it's pierced by the internal laryngeal nerve as well as the superior laryngeal nerve. The superior laryngeal nerve divides into the external laryngeal nerve as well as the internal laryngeal nerve. All intrinsic muscles of the larynx are innervated by the recurrent laryngeal nerve, except the cricothyroid, which is innervated by the external branch of the superior laryngeal nerve. Now, something that you have to know for the MRCS as well as for dentistry and facial max is that the recurrent laryngeal nerve on the left is longer than the recurrent laryngeal nerve on the right. And this is due to the fact that the aorta is slightly lower than the subclavian on the right. You're probably asking, what is the purpose of the internal branch of the superior laryngeal nerve? So the internal branch of the superior laryngeal, remember the external branch of the superior laryngeal nerve innervates the cricothyroid. but the internal branch actually innervates the vocal folds, and this is sensory innervation of the larynx via the internal branch of the superior laryngeal nerve. Below the vocal folds, innervation is via the recurrent laryngeal nerve. So just to repeat, above the vocal folds, innervation is via the internal laryngeal nerve, internal branch of the superior laryngeal nerve, and below the vocal folds is via the recurrent laryngeal nerve. So as I mentioned before, found in the carotid triangle. Remember I told you the acronym for the branch of the external carotid, which should be SALFOPS. So SALFO is found in which is the superior thyroid, ascending pharyngeal, linguofacial, and occipital branches of the carotid are found within the carotid triangle. The external carotid, the internal carotid, which lies side by side, the internal jugular vein, which is lateral to the common carotid, and the internal carotid, and the veins corresponding to the branches of the external carotid artery. So the carotid sheath, seen right here, you can see that this is the esophagus, this is a trachea, this is the carotid sheath. So the carotid sheath contains the common carotid medially, the internal jugular vein laterally, and the vagus nerve posteriorly. And then posterior to the sheath, there's a sympathetic plexus or a sympathetic trunk. So just remember that laterally is the internal jugular vein, medially is the common carotid, posteriorly is the vagus nerve, and posterior to that, or just lining on the outside of the sheath, is the sympathetic trunk. Now you're going to see the carotid sheath come back again, and the carotid sheath in itself is formed by pipe, P-I-P-E. It's formed by three main things: the pretracheal, investing, and the prevertebral fascia. So let me repeat that. So you can see here, that's the prevertebral, this is the pretracheal, here running backwards, and then the investing fascia. So three fascia form the carotid sheath, but you can remember it via the acronym PIPE. So the prevertebral, investing, and pretracheal fascia forms the carotid sheath. Okay, the next triangle that we're going to look at, moving back to the pictures, is the muscular triangle. Muscular triangle is bounded anteriorly by the median line of the neck from the hyoid to the sternum. It's bounded posteriorly by the sternocleidomastoid, superiorly by the superior belly of the omohyoid, and the roof is formed by the superficial fascia as well as the platysma. So the platysma actually forms the roof, part of the roof for the carotid triangle as well as the muscular triangle. So the floor of the muscular triangle is formed by the sternohyoid and the sternothyroid. And the contents, once again, common carotid artery, internal jugular vein, vagus nerve. And these are contained in the carotid sheath. As mentioned before, internal jugular vein laterally, common carotid medially, vagus nerve posteriorly. Remember that. Anterior to the sheath is the anterior cervicalis, and posterior to the sheath is the internal thyroid artery, recurrent nerve, and the sympathetic trunk. So, as you can see here, you're looking at the diagram. Posterior to the sheath, you can see the sympathetic trunk right there. So, medial to the sheath, or medially within the actual muscular triangle, you have the trachea, esophagus, thyroid, and lower part of the larynx. Okay, so anterior to the sheath, you have the anterior cervicalis. Posterior to the sheath, you have the internal thyroid artery, recurrent nerve, and the sympathetic trunk. Medial to the sheath, you have the trachea, esophagus, thyroid, as well as the lower part of the larynx. Okay, so that's just the orientation of the carotid sheath. Next triangle we're going to look at is the submandibular triangle. Submandibular triangle is right here, and it's, as you can see, anteriorly is bounded by the anterior belly of the digastric, or antero-inferiorly. Posterior inferior is bounded by the posterior belly of the digastric. Superior is bounded by the mandible. Okay, so what is it covered by? It's covered by the integument, superficial fascia, and once again the platysma is there again, and the deep fascia. So the deep fascia, which contains the facial nerve, and as well as the is and the ascending filaments of the cutaneous cervical nerve. So it contains facial nerve branches and the ascending filaments of the cutaneous cervical nerve. The floor of the submandibular triangle is the anterior mylohyoid. It's anteriorly bounded by the mylohyoid bone, and posterior by the hypoglossus. So the contents of the anterior part of the submandibular gland, of the submandibular triangle, is the submandibular gland. Superficially, you have the anterior facial vein, and then embedded in the gland itself is the facial artery and its branches. Beneath the gland, on the mylohyoid muscle, lies the submental and the mylohyoid artery and nerve. So beneath the gland, on the mylohyoid muscle itself, lies the submental artery, mylohyoid artery, and nerve. But remember that within the gland, embedded in the gland itself, lies the facial artery and branches. And superficially, on the gland itself, lies the anterior facial vein. So it's vein, artery, and branches. And so it's from superficial to deep: vein, facial artery and branches, and then submental and mylohyoid artery and nerve. So vein, what would be a nice acronym for that? There will be VA. So vein, artery, nerve. So it moves from vein to artery to nerve. So it spells VAN. But remember that there are 3 arteries in the center. So vein, facial artery, submental artery, mylohyoid artery, and nerve. Posteriorly, so remember that was the anterior part of the submental triangle, submandibular triangle. So posteriorly in the submandibular triangle, you find the external carotid artery rising into the substance of the parotid gland, so interesting thing about the submandibular triangle: external carotid is separated from the internal carotid via the styloglossus and the stylopharyngeus, as well as the glossopharyngeal nerve. So the nerves present within the actual submandibular triangle, cranial nerve 9, 10, and 12 are present, as well as the mylohyoid nerve. As you remember that the mylohyoid nerve lies within the anterior part of the triangle, while posteriorly lies the external carotid, as well as cranial nerve 12. So anteriorly lies the mylohyoid nerve, as well as the cranial nerve. Mylohyoid nerve lies in the anterior part, and posterior lies cranial nerve 12 and 9, 9, 10, and 12. So the vessels within the actual submandibular triangle: facial artery, facial vein, external carotid, and internal carotid, separated by the styloglossus and stylopharyngeus, as well as the glossopharyngeal nerve, styloglossus and stylopharyngeus muscles, and the glossopharyngeal nerve, as well as the submental vessels, as you know, which lie in the anterior part of the submandibular triangle, as well as the mylohyoid vessels, which lies in the anterior part of the submandibular triangle, as well as the lymph nodes. So the next and final triangle that we're going to be looking at is the submental triangle, which is bounded posteriorly by the anterior belly of the digastric, anteriorly by the midline of the neck between the mandible and the hyoid bone, and inferiorly is bounded by the hyoid bone. The floor is actually by the mylohyoid muscle, just as you remember that the floor of the submandibular gland is a mylohyoid muscle as well too. And the contents will be submental lymph nodes, small veins which unite to form the anterior jugular vein, the submental artery, so submental lymph nodes, submental artery, lymph nodes, lymph glands, as well as small veins which unite to form the anterior jugular vein. So that's it for the anterior triangle. I hope I was helpful. Feel free to leave a comment. If you want me to clarify anything, please feel free to do so. I'm going to try to do a few fitness videos, as well as a few videos to deal with the temporal fossa, as well as the other fossa present in the skull. Trying to keep it at head and neck, but if you have any other requests about the lower limb or upper limb, I can assist in that way too.